Pearson. I'm a family nurse practitioner with the Uptown Nephrology Group in New Orleans, Louisiana. And we have our expert panelists here, and I'm going to go over with any of them. If you have any questions during this live session, feel free to put them in the comment section and they will get them over to me and we will answer your questions. So joining us tonight is Toro OBGYN, Dr. Jennifer Mills Messina.
Hi there.
Hi. LSU and Toro NICU neonatologist, Dr. Julie Galloway.
Hi.
Hi. And LSU and Toro maternal fetal medicine physician, Dr. Asha Hurd.
Hi, everybody.
Hi, Dr. Hurd. So we're going to start off with our first question. And our first question is, I'm pregnant and should I get the COVID-19 vaccine? And I can honestly answer this one personally. I'm currently pregnant with my second child, and I did opt to receive the vaccine at 24 weeks and 27 weeks. And one of the reasons why I did get the vaccine is there were so many, my OB and I discussed this, and really it came down to the fact that if I contracted the virus during my third trimester of pregnancy, that it would actually be more detrimental to have the virus than it was actually to get the vaccine. So when I started looking at, you know, if I got the vaccine, it would help protect my patients, and it would also may possibly help protect my baby too. When my baby's born, I realized that the benefits clearly outweighed the risk of the vaccine. I got both doses. I have felt fine and had absolutely no side effects. So I do encourage other women who are pregnant to seriously consider getting the vaccine. So our next question is going to be for Dr. Asha Hurd. I'm planning pregnancy in the near future. Should I get the vaccine now or wait?
Yeah, so that's a really great question that has come up a lot recently. And the short answer is that if you're eligible to get the vaccine, I would strongly encourage you to get the vaccine as soon as you can. Currently, there's no recommendations to wait to try to become pregnant. And I know that there's a lot of misinformation out there on the internet about the possible effects of getting the vaccine and infertility or pregnancy complications. And right now, there's no evidence to suggest that getting the vaccine will impact your fertility at all. And so my recommendation would be that if you're otherwise eligible to get the vaccine, to go ahead and seriously consider getting it.
Okay, all right, thank you. All right, our next question is going to be for Dr. Jennifer Mills Messina. If I decided to get the vaccine during pregnancy, does it matter when I get vaccinated during my pregnancy?
Well, that is a very good question. And that has come up a lot. A lot of times it seems that we try to be a little safer in the first trimester. And I've had, you know, patients ask if they should wait. There is really no information that shows that the vaccine has any, you know, detriments on pregnancy. The side effects aren't any different in a pregnant person and a not pregnant person. And I really, you should just weigh the risks of getting COVID during pregnancy, because it has been established that if you are pregnant and you do come down with COVID, that unfortunately you may have a more severe case. You know, your risk of admission to the ICU is higher. Your risk of, you know, preterm delivery is higher. And so my personal belief is that when you are eligible to receive the vaccine, you should get the vaccine.
Okay, wonderful. All right, so we do have a question from Christy. And she says, and this might be more for Dr. Mills Messina, I'm inducing on March 9th or 15th. If I can get the vaccine before delivery at this point, should I? I'm 36 and a half weeks, and we'll start with that question.
Yeah, that is a very good question. And I actually even had that come up very recently with a patient of my own. She opted to go ahead and get the vaccine, got her first dose at 37 weeks, and she just so happened to be able to get the second one before delivery. But I would feel that if you are able to get the vaccine, to get it. And, you know, the second dose, I mean, you should get it around that time, but if I don't see that there would be any reason why you wouldn't be able to get the second dose, even if you know, delivered a few days
Okay.
before.
All right. And then the next question that Christy also had is it safe to breastfeed after vaccination? And Dr. Galloway, do you want to take this question?
Yeah, sure. So this is a question that comes up quite often, and a couple of the larger societies have weighed in specifically about this. So one of the leading experts in this field is the Academy of Breastfeeding Medicine. And when you look at their latest statement about breastfeeding and the COVID vaccine, what they say is that they do not recommend stopping breastfeeding for individuals who are vaccinated against COVID. Um, it's very unlikely that biologically the vaccine could be processed in your body and then get to the breast tissue and then be excreted in the milk. If that were to happen, it's the stomach acid in the babies is very strong, and the vaccine itself would not survive in that condition. So it's recommended by the Academy of Breastfeeding Medicine to not stop lactating, to not stop breastfeeding, and to discuss it with your pediatrician or your healthcare provider about what your risks are if you were to get sick with COVID, and then also to what the risks are of not breastfeeding your baby, because there's certainly risks for not breastfeeding your baby. This should always be a shared decision making, weighing all the risks and benefits. What we do know is that there is likely antibodies that moms produce in their breast milk. So several studies have shown that moms who have had the actual COVID virus definitely do produce antibodies, and those have been found in the milk. We don't know how much antibodies need to be produced to protect the babies. We don't know a lot about if you get the vaccine and then what happens in your breast milk. But those are some ongoing studies, and some preliminary data is promising. We just don't know yet what the benefits of the vaccine antibodies are. We do know that moms who have had COVID produce very specific antibodies in their breast milk for infants.
Okay. And also, Dr. Galloway, I think this next question comes from a viewer. Her name's Elise, and she wanted to know, she's worried about the long-term effects of the baby, specifically on the nervous system, and maybe other health problems. Because there's no other studies, how can we be sure that there won't be any long-term effects on the baby if you receive the vaccine?
Sure, that's a good question. And the answer is we really don't know yet, specifically driven by data. But there's an ongoing debate about whether pregnant women should be in vaccine trials. Those things are certainly grounded in good intentions, but some experts have said, are we going too far if the pregnant women and newborns can't benefit from the needed vaccines? And part of that is the data collection. So there are a lot of people now who have received the vaccine, who are feeding their infants, and they're starting to collect data now. There are other vaccines that are similar to this that have been given in pregnancy and that have not affected infants. There are very few vaccines that would be contraindicated. So what we think is that it should be fine, but we certainly do need to collect data to prove that.
Okay. All right. So for Dr. Mills Messina, one of the questions is that I've heard that some people have had reactions after the vaccination. Are these dangerous in pregnancy, the vaccine-associated reactions?
That is very true. A lot of people will get reactions. I've had a low-grade fever and some aches, and went to bed and felt fine the next day. But it has been established that pregnant women do not tend to have more severe side effects than non-pregnant women. If you have a low-grade fever, take some Tylenol. There has not been any, links to, problems in pregnancy, preterm deliveries or anything, detrimental. So the answer is no.
Okay. All right. This next question is going to be for Dr. Asha Hurd. What if I become pregnant between the first vaccine and the second dose?
Yeah, that's a good question that has come up from several patients so far. And currently the recommendation is if you get pregnant between the first and second vaccines, to go ahead and get the second dose. There's no reason why we think you shouldn't get it. And actually, since you are pregnant, it would be beneficial to have the protection of the vaccine during your pregnancy. So the recommendation currently is to go ahead and get the second dose.
All right. Okay, next question. This is going to be for Dr. Mills Messina. I'm planning on pregnancy in the near future. Should I get the vaccine now or wait?
I think to get the vaccine now.
Okay.
That would be my personal belief. I mean, I really feel that everyone should get it as soon as they're able.
Okay. And then next for Dr. Hurd, this is one thing that I find kind of comes up quite a bit, especially with social media. And there actually was some stuff on the news about this too. So I'm wondering if you can clarify this for us. Were fetal cells from aborted fetuses used in the development of the COVID-19 vaccine?
No,
Okay.
they were not. They weren't. That's really the only answer. There is, but I do think, Brittany, you bring up a really good point. There's a lot of misinformation on social media and on the internet. And so I really would encourage everybody to talk to your doctors if you have specific concerns, because they will be able to answer your questions, to go through your personal history, and really be able to clarify your concerns.
Okay. All right. I think our next question is going to be for Dr. Mills Messina again. If I have received another vaccine during pregnancy, do I have to wait to get the COVID-19 vaccine?
I don't think that there are any real hard and fast rules that you would have to wait. However, sometimes I would say that maybe not getting them the same day, just because a lot of times you are going to have a little bit of an effect. Even, when you get the flu shot, your arm's going to be a little sore. And, it's the same way with the COVID vaccine. And I would, say, spacing them out, a few days would be reasonable. Just so if you had side effects, maybe they wouldn't multiply from getting, two vaccines on one day.
Okay. And I'm sure a lot of women who are pregnant would address that, especially since the flu vaccine is still encouraged at this time. And then also the Tdap. So I'm sure that's something that's certainly a concern.
Exactly. And that's usually what I recommend, get your flu vaccine today. When you come back in 2 weeks, we'll get your Tdap. So, yeah.
Okay. All right. Let's see. Is there anything else anybody wants to add to say?
Well, I think that it's important to note that our governor has opened up the COVID vaccine to all pregnant women starting Monday.
Yes.
That's a lot of the added, a lot more to the role. So,
okay. Okay. And we have a question from Sarah. And so she said, this is actually a great question. I did not think twice about getting the flu vaccine during pregnancy. What can you tell us about the differences between the flu vaccine and the COVID vaccine? So I guess if Dr. Mills Messina wants to address this, or even one of the other doctors, please chime in on this.
Yeah, well, the COVID vaccine, it's a messenger RNA. It does not impact, your DNA. It's broken down in the cells, very, very quickly. And it's, known to be safe. The flu vaccine, I guess they change it every year. You guys may want to help me out on this as far as how I know it's not, a live virus, but
yeah, they're made differently in terms of how they help your body recognize the virus going forward, but neither of them use the live or any portions of live virus. So you can't actually get the flu, you can't actually get COVID-19 from the vaccine. So I think that that's important for people to know. I think that, obviously one of the hesitations for everybody is that we don't have data, right? This is very new. COVID is only a year plus old. But I think it's also important to sort of weigh that against the potential long-term effects of COVID, right? So the question earlier about we don't know what the effects of the vaccine are on me and my baby. Well, we also don't know what the long-term effects of having COVID infection are while you're pregnant. And so I think when you think about risks and benefits and pros and cons, it's important to look at both sides.
I think this next question will go back to Dr. Galois. I know we've been talking about breastfeeding, and of course, if there's really any type of anything, is there anything out there that they're preliminarily putting out about studies about the effects, any data from volunteers who happen to get pregnant or are breastfeeding during the vaccine trials? Is there anything that we know about that at all? That
So,
they've maybe put out recently?
initially they did not allow pregnant women or lactating women in the trials. So it's interesting when you have emergency use authorization, like for the frontline healthcare workers, if you're pregnant, then you can get it. And those placebo-controlled studies like the Pfizer and the Moderna, basically a 50% chance of getting it, even if, you have disclosed that you were pregnant. And so there wasn't a lot of people. But what has been reported is that in the Pfizer trial, 23 women did get pregnant, and then in the Moderna trial, 13 women got pregnant. From the case reports that are available, there were no complications related to the vaccine. That there were good outcomes and healthy children born. Now we have estimates of over 10,000.
Okay.
Okay.
I think I'm back. I'm so sorry. Technical difficulty.
Yeah. So I think where we had ended was the last question was about the women in the trials, and we said that it looked like from the women who were in the trials that they had okay outcomes, and that now over 10,000 pregnant women have been reported to have been vaccinated. So there are ongoing trials, some observational trials. I know specifically at Duke looking at COVID-19 vaccination and pregnancy, and those are things sponsored by the CDC. There are some case reports coming out of, there was at least one that was electronically admitted to a journal, where it was a mom who got the vaccine at 36 weeks. She delivered at 39 weeks. And when they tested the baby's cord blood, the baby did have a specific antibody to COVID-19. So it does look like the maternal, we know that if the mom's had COVID, that those levels of antibodies, those antibodies are found in the cord. And we know that specifically that. So now there are some case reports coming out of moms who have had the vaccine passing the antibodies through the cord to the placenta to the baby. And again, as more of these women are now getting the vaccine and delivering, we'll have more data to follow.
Okay, wonderful. Okay, I think that's all the questions. Do any of our other physicians want to contribute anything that they think that's really important that everybody should know? If somebody's pregnant, what they should consider with the vaccine?
Well, I think that it absolutely is a personal decision, and it's definitely something that you should talk to your healthcare provider regarding.
Okay. We did get one more question. We had a question from Elizabeth. Is there one vaccine that's better over the other for pregnant women, Pfizer versus Moderna, and do they work the exact same way?
Take that. There's no difference that we know of between the Pfizer and Moderna vaccines in terms of how they're related to pregnancy. They're very similar in the way that they are made and the way that they act. And it's really just two different companies. So right now, there's really no preferred vaccine for pregnant women. And I'd also like to echo what my colleagues have said in terms of if you are pregnant and now will be eligible, thanks to the governor and the Louisiana Department of Health for the vaccine, please do talk to your doctor about getting the vaccine and your personal risk versus benefit profile.
Okay.
It looks like there was a question that popped up that I don't think we got to is when we got disconnected about if women can get their vaccine administered by their OBs or if they have to go someplace special to get their vaccine.
I can order a vaccine. So, yeah, if it's not something, I guess, that's being offered at your workplace, yes, absolutely. There is a clinic that I'm able to schedule appointments.
Okay. And do we know if like our big retailers like Walmart or Walgreens and CVS would be able to give it to pregnant women, or is that kind of still something we're not too sure of just right now?
That would be something probably I'm not sure of. I don't know if you would note from your doctor. I'm not really sure. Since this information, it just came out.
Yes.
Yeah.
All right. Well, I think that's going to be it for this Facebook Live question and answer session. If anybody has any further questions, please feel free to put them in the comment section and we will make sure that we, oh, actually we got one more. Hold on. This one's from Elise and she's asking, when is the best time to get the vaccine in order to pass immunity to the baby?
So I'm not sure that we know that much yet. Dr. Hurd and Dr. Mills-Messina may have a little bit more information about that. I know that there was a big study that was published in JAMA Pediatrics that looked at cord blood from babies. And so 72 out of 83 pregnant women had the virus and there was COVID antibodies that were passed to the baby. Now, these were women who had the COVID virus, not specifically the vaccine, but the concentration of the cord blood antibodies did correlate with the level of maternal antibodies. And then it also correlated between the time between the infection and the delivery. So if mom's antibodies were high, the cord blood or the blood to the baby, those antibodies were higher. And if you had it longer, if you had the virus longer before delivery, then there was more antibodies passed to the baby. So we don't know if that correlates with the vaccine. But what was published in that particular article was that it was 17 days was the minimum amount of time that moms had to have had the vaccine before the antibodies were found to the baby. So that could be some information for the vaccine, but we don't have that same data for the vaccine as we do for the moms who had COVID.
Good. Okay. All right. Well, I think that's going to wrap up our live question and answer session. Thank you all very much for participating. And again, if any of our viewers have any questions, you can put them in the comment section and we'll get them to our panelists and have them answered for you. Thank you all very much.
Thank you. Bye-bye.